Assalamualaikum warahmatullahi wabarakatuh. Good evening, everyone. So today I'm going to perform thorax physical exam. And firstly, I will assess the patient's anamnesis, including the names and then the other biodynamics for the patients, and also asking for the historical patient's record. And after that, we can also ask for the patient's consent before we perform, whether the patients are willing to be assessed or not. And before that, we also have to ensure our hands are not dirty and clean, so we have to wash our hands and ensure everything, our tools like stethoscope and then light and everything is around. So there are some steps to perform the physical exam for thoracic. First one is inspection, so we see the patient's face and then the patient's appearance, and then the palpations. And then we also assess for the percussions, and the last one is occultations. So the first one is, we see the inspection for the surface and also the shape of the patient's body. So we also see if there any patients have a tattoo or any other bulging in the patients. We see the first appearance of the patient. And then after that, we can also assess for right and the left are the same from the limit of the patient, if the patient's muscles breathing, like gasping or not. So for the second one, we also inspect for the palpations. So there are two palpations. The first one when we use either our palmar or our ulnar, so we assess both the anterior and posterior. And the second one when we use for expansion, right, like this. Okay, so for the first one we assess for either in the anterior, posterior, and also the hemithorax. And we hear for the focal primitus. So for the focal primitus itself, we can ask the patient to say 77, and then we assess it to hear if there are any consolidations or not. If there's any consolidations, then the vibration or tactile could be more higher, and then if there's no, then it could be there's blockage in the pathways or channels in the respiratory. And then we ask like this, and then there's also some parts to assess the palpations, like here, here, and also including the posterior, like there are 1, 2, 3, 4, 5 until 6 or until 8. And then also we assess for the expansion, so we use these two hands to see if there's any bulging or any pains that the patients have, like this. Okay, that's the second step. And then we move on to the third step. So the third one, which is we can assess for using our hands. There's two hands, so we use this in the middle of our fingers, and also we use this like this. And we can starting from the vertical, and then coming right down into the either on the right and the left, and then we assess it with zigzag like this. And also we have to ensure it's in the midclavicular. There's midclavicular that separated. So like this. Like that until 6 parts. Basically it's 6 times 2, it's like 12 in total, but we don't have to assess anything. We just have to ensure that either in there's comparison between the right and the left in the left sides are the same. And expect the patients normally having a sonar, because we have the dull, the sonar, hypersonar, and tympani. But when we do this, we mostly see the patients normally is sonar. Okay, so the last step is occultation. So we assess the occultation's heart are the same, coming from the upper to the lower respiratory, clavicular separated. And then we also have the parts are 6 times 2, and then we assess it through zigzag like this. For the parameters of the body, we also have a few lines. The first one in the trachea, the bronchial, the bronchosacral, and also the vesicular. And then coming from the inspirator itself, we ask the patients to have an inspiration expiration. We ensure that the sounds in the trachea are the same And then in the brachial, the inspiration could be more higher. And the bronchitis are the same. And the last one in the vesicular is the inspiration could be more lower, and the expiration could be more higher. Positions zigzag. And then we can hear is it the patient circles, breathing or bronchi. Okay, so that's the physical exam for thorax. So before we finish the physical examination, we ensure that we wash our hands, and then we make conclusion to the patient about the information that we have. And then after that, we can refer to the patient's boarding examination. Okay, that's all. Thank you for me.